वेलकम टू हेल्थ टॉक लाइव टॉक शो। जैसा कि हम सब जानते हैं, हेल्थ इज वेल्थ एंड प्रिकॉशन इज बेटर देन क्योर। आज हमारे साथ हैं डॉक्टर एम एस कंवर। ही इज पल्मोनरी क्रिटिकल केयर स्पेशलिस्ट एंड सीनियर मेंबर कोविड टीम फ्रॉम इंद्रप्रस्थ अपोलो हॉस्पिटल, वन ऑफ द बेस्ट हॉस्पिटल इन इंडिया। तो आइए जानते हैं कोरोना के कहर से कैसे बचा जाए। वेलकम टू
Well,
शो डॉक्टर, हाउ आर यू?
I'm fine, Rashmi.
But before we
It's
start,
all
Dr.
good
Kanwar, I
except
would
for
like to
the.
congratulate you on receiving Lifetime Achievement Award.
Thank you so much, Rashmi. Thanks a
Yeah,
lot.
we are proud of you, Dr. Kanwar, and
Thanks.
the whole world is proud of you, I should say.
Well, I'm feeling humbled on that. Uh, but well, um, we've been working on a lot of these issues, and it's good to see that somebody recognizes it and considers giving an award. So that is very humbling, but a, a good feeling to have that somebody is recognizing it.
Of course, we are blessed to have you with us, डॉक्टर कंवर। एंड आपने इस कोविड के दौर में जो आपने हम सब की सहायता की, आई शुड से, यू आर ऑलवेज बीइंग गाइडिंग अस, गिविंग अस लाइमलाइट ऑन हाउ टू बी प्रिकॉशियस and how we can save our life. So I would like to thank you on behalf of all our viewers. Thank you so much. सर डॉक्टर कंवर, अभी जो चल
And
रहा है उसके बारे में भी मैं आपसे जानना चाहती हूँ। एंड सो व्हाट इज ऑल दिस लाइक द करंट पोजीशन ऑफ न्यू स्ट्रेन ऑफ कोरोना वायरस फाउंड इन यूके?
well, this is a new thing. While we were all hoping that Corona will eventually die its own death, or people all over the world will have a herd immunity gradually, and the vaccines would finally, uh, kind of be the final nail on the coffin for coronavirus. That was the view of the optimists, and I'm one of the optimists thinking like that. But and we were hoping that in the first quarter of 2021, Corona would be just a secondary thing. It would not be the main issue for the governments, for the public, for an individual. But the things have been changing, and now suddenly, and for example, even before this strain came, the situation in the US hasn't been good still. It is still ravaging in certain states. Uh, while in Southeast Asia, let's say in Far East Asia, the disease has been only sporadic. I mean, it is there, of course, but well under control. Only there are certain areas where there is a spurt, and then they control that. They do local lockdowns and control that. But it's not so widespread spread in the Far East. Even in India, in South Asia, the disease has come down, is coming down. I mean, if I give you the example of Delhi, the number of cases were had almost touched 10,000 a day, new cases, almost 10,000 a day, 900, 500, 9,500 something per day. And it was actually uh, going on like that for a few weeks, more than 7,000, 8,000 for a few weeks at a stretch. And then they started coming down, and now it is under 2000 new cases. And today my hospital's census, also today's census
Mm-hmm.
in the Prasapur hospital, is also saying that the inpatients have come down over the last 2 weeks or 3 weeks now.
Mm-hmm.
Over the last 3 weeks,
Yeah.
the numbers have been coming down, and so the numbers are probably about one half than they were about a month ago, a month and a half ago.
Okay.
So overall, the inpatients as well as the outpatients are not so burdened anymore. But now, this is what we were thinking, that eventually this third wave is also
Yeah.
coming to an end, hopefully. But the new thing that you asked me about, the new strain, which they found in England. They first noticed that in September, in one of the cases, which was found in South London area in the county of Kent. Um, uh, this is actually, I'm right now uh, in Kent area.
Okay.
So
Okay.
this is where the new strain came on,
Yeah.
and they started studying that. By the last week, they had actually seen 1,104 cases. So 1,100 cases over a period of 3 months from September to December.
Okay.
And then they found also that the newer cases that they are seeing, they are largely the new strain. The old strain is much less now. So they also then started seeing the behavior, and they found that this new strain spreads much faster,
Oh, okay.
about 70%, about 70% faster than the original COVID-19 strain. And the other difference in the character is that these are the two major differences: the spread, and that it doesn't spare the children. Like the
Oh,
original strain, we were quite comfortable about it not hitting the children, and
yeah.
under 15 years of age, there were very few children who
Yeah.
were infected as compared to adults. And that's why even our pediatric wards were not overwhelmed at any point.
Yeah.
And the mortality figures in children was also much less than adults. But this new strain is affecting the children across the board. So now there are new concerns about the schools, the reopening of the schools after Christmas. Um, you can imagine the scenario that if the children are infected as fast as the adults, then the possibility of one child infecting the entire class,
Yeah.
which would be a congregation, even if you do 2 meter distancing, even if you do take all those steps, you would still be in a room which would be heated these days, and would be a closed room. It would not be open ventilation there in such a cold country. You get my
Yeah.
point. In a classroom which is heated and the windows are closed, so you're if there is one child, it
Yes.
can it can bypass those
Of
two
course.
meter things,
Of course.
so let's forget about these 2 meter distancing.
Yeah.
They are droplets which go up to 2 meters, but there are smaller particles also which stay in the air for a few hours, which keep floating, and they could still be the source of infection to others. So now the concern with the government is when to reopen the schools post Christmas, and that call they will take after 11th. They have already postponed from 4th January to 12th January, but they will further take the call whether it would be safe for opening the schools, or should they be going online for education for the children. And they've already started sounding this to the parents, that they should be prepared in case they need to go on online for the education of the children. So the parents are also online. If the children are also online, and who is going to handle the children? That's going to be another issue.
Of course. Of
You
course.
get my point? I
Mm-hmm.
mean, if both the parents are doing online their office work,
Yeah.
who's going to look after how are the children going to do online on their own?
Very difficult.
So it's a very tough call,
Yeah.
and I don't know. They probably will have to look for different kind of answers. Um, it's not going to be easy. or they
But
may
Dr.
just
Kanwar, there was a ray of
close on
hope
the.
that we had vaccine and everybody was feeling relieved that okay, in few months we will be back to normal, and now this is again a stressful situation. So 2021 is not indicating that great sign, I should say. Like still it is a very stressful situation, and I would like to know that is this vaccine helping in the new form of virus what we are having, or we need to have something new for that?
Okay, very good question. Luckily, the indications at the moment are that this virus, the mutant virus, is, or the new variant, whatever you may call it, is not going to bypass the vaccinations that are underway. So the vaccines are going to be effective.
Mm-hmm.
So these are the preliminary indications. So they won't have to make any modification in
Okay.
the vaccine or the tweaking of the vaccine as of now. They don't need to do that. But Rashmi, from your this question, another thing arises that we that by August 2020,
Mm-hmm.
um, from the beginning when the virus started in November,
Yeah.
it actually started in November,
Yeah.
but it was picked up in December
Yes.
in China. Uh, so the point is, from November to August, there were six mutations, but
Mm-hmm.
those mutations they were picked up,
Yeah.
studied,
Yeah.
and the genomic structure was well studied.
Mm-hmm.
They found that none of those mutations were significant enough to cause any different kind of treatment strategy or any different warnings to the public, because the behavior of the virus was by and large the same. But let me tell you, we over the last 9 months did notice
Yeah.
change in behavior in the way that some patients were, at some point in time, they came in clusters. Let's say for a couple of months, patients would complain of headache.
Okay.
Then came a time when nobody was complaining of headache.
Oh,
They were
okay.
complaining of diarrhea.
Oh.
They were complaining of diarrhea. And then the diarrhea phase went away. Then there was few symptoms which were common, like fever, cough,
Yeah.
and loss of smell
Yeah.
or
Yeah.
loss of taste. They were common,
Yes. Yes.
but the other features were a bit variable. So we were among ourselves, with my medical colleagues, we were wondering whether the virus is mutating,
Yeah.
whether there's a change in character of the virus. Probably it was happening like that.
Yeah.
So the mutations are happening, and those mutations are not documented in a way that unless there is a major change in character, they won't talk about that. The scientists know those things, but they won't talk about that. But this new thing has altered our thinking in a big way. Now, in a way, for example, if this virus today is not uh, necessitating a tweaking of the vaccination today, suppose another mutation happens a few months down the line, or 4 months, 6 months, 8 months down the line, just like this one, a major mutation came in,
Yeah.
and that leads to something like not evading, let's say, evading the vaccination, or the vaccination not being effective against that mutant. What happens then?
Yeah.
You have to tweak the vaccination. The vaccination can be tweaked to take care of the mutant,
Yes.
but that takes time.
Yeah.
Look at the logistics. You tweak that and then revaccinate the entire world. It will take another 6 months or a year. By that time, a new mutant will come.
So, Dr.
Before
Kanwar,
you
how we'll
vaccinate,
get back to our
that
normal
that
lives?
that mutant that mutant would have already infected the world. So that is why, these are the thoughts which are very uh, sombering sort of thoughts, which uh, scientists are quite aware of, and they would be thinking of steps ahead of the virus, but they are not going to they are not going to rest and sleep over these things, which are possibilities, but which haven't happened so far. But what has happened, they are tackling that. So in Britain, for example, there have been widespread lockdowns from day after tomorrow. Today is 24th,
Yeah,
23rd.
20.
Sorry. From 26th, the Boxing Day, midnight, most of England would be, except a few areas, would be under tier 4. Tier 4 means complete lockdown, where your shops are closed. There are only takeaways which you can use. You cannot be wandering around unnecessarily, so you couldn't be seen in groups. Even the families, they have to be, under certain restraints. So this kind of lockdown would probably continue. Um, Several weeks, and they haven't given a date that the lockdown is from this to this date. So they have kept it open ended, so dependent on what numbers they are seeing, because the numbers in the hospitals, the admissions in the hospital has spiked in the last 1 or 2 weeks. It has spiked, and in fact they said that in the last 1 week the number of admission to hospital has doubled than the previous week, and so is the outpatient numbers, and so they are very, very concerned here, and especially with the things happening so fast, and mainly happening due to the new mutant. So how the new mutant would behave mathematically over the next month or two, that is what is concerning the scientists.
And what about the symptoms, like how you know that you are being affected with this new strain?
Yeah, the way I told you that we didn't have those genomic data telling us so that the virus has mutated a little bit between the months, this and this, and then something else happened. But we saw those things happening, as I just told you. So these, symptoms like fever is the commonest symptom,
Okay,
followed by sore throat and cough, and a lot of patients have loss of smell and change of taste.
okay.
Now, the loss of smell and change of taste
Mm-hmm.
are the only most specific symptom for COVID-19.
Okay.
Other things like cough and fever can happen due to so many things,
Yeah, of course.
but loss of smell and taste or change in taste will not happen in any other disease except COVID-19. So if that thing happens, you would immediately go for testing, even if you don't have fever, even if you don't have cough. So you should go for testing. So the other things which this new virus is supposed to be having more commonly is fatigue, malaise, headache, diarrhea, uh, even skin rash,
Oh,
which
okay.
earlier we saw rarely
Mm-hmm.
in COVID. Very few cases of skin rash, but this thing is being seen in the new virus variant. Even confusion was never seen as a symptom in the the usual usual COVID-19. Now we'll have to talk about the original COVID-19 and the variant. We'll have to use our terms like original and variant.
Yes.
So these are symptoms which loss of appetite also. These
Okay.
are the symptoms
Okay.
which we saw in the earlier the original virus also. I mean, for example, in original virus we saw diarrhea,
Hmm.
though it did not last too long, a few months, headache, tiredness, fatigue,
Okay.
malaise, and of course, change of taste was frequent. So, some patients complained of chest pain. So, these features were there, but the newer virus, the newer variant, the symptoms which I just told you, they are also prominent. They are probably more prominent than the previous one. But I think these symptoms are, whatever I told you, they were all expected. They are expected in COVID, in some percentage or the other. Whether it happens in 20%, any particular symptom, or in 40%, doesn't matter. What matters is two things. How, what is the severity of the disease? If the severity of the disease is the same,
Mhm.
like the original variant, the original COVID-19, then we are not so worried,
Yeah.
because the mortality goes up,
Yeah.
then that is a tragedy, because then you will see a lot of people who suffer from COVID would be losing their lives. The other thing, second thing, is how much contagious it is.
Yeah.
Now, this variant is far more contagious than the original COVID-19. That means you can easily catch from one person can easily catch from the other. So that 2 meter distance actually may not hold good for this variant.
Oh my God.
We may have to rethink. We may have to rethink about that, because all those experiments which were done for the original COVID-19 would probably have to be tested again on this variant to be able to tell us what is the 2 meter distance. Because with 2 meter distance, if the infectivity rate goes up by 70%, then you have to do a rethink on that,
And
and
Dr.
and
Kanwar, we
think
were
of.
very positive, like in December, everything will be fine. It is the same situation what we had in March 2020. So are we back to that situation, you say?
Uh, Let me hope that this new variant doesn't spread like wildfire all over the world. In a in It is already in Spain, it is already in Italy, it is already in Netherlands, and it is already in Denmark. It
Yeah,
is
the
already in
last flight
Australia.
passenger from UK, I'm thinking maybe if he had that virus, it can be spreaded.
Yeah, but though they are doing their testing, those tests are done even at the point of entry in those countries. For example, even in India,
Hmm.
they do the test,
Yeah.
and if you're positive, they immediately put you under their own quarantine system. And if you're negative, only then you go home. So I mean, but I don't know whether it is happening in all the countries or not. But in many countries, the point of entry is where they do the retesting at that point. Even if you carry a certificate,
Uh,
sometimes even if you carry a certificate of 5 days old that I'm COVID-19
okay.
19 negative, they may still ask for a retest, and they may not allow you to go home.
Yeah, but Dr. Cover, I feel people who will be traveling from UK to other countries when the flights will be open, of course, after 31st of December. Do you
Oh,
think
well,
it's
probably
safe?
not. Probably not 31st. They probably would delay that. They
It should be
probably would
delayed, you
delay
mean to
that.
say.
I'm afraid they would delay that.
So they must
Mhm.
delay it, right? It's not safe for them to start flights on 31st of December. That is the last day of.
It is safe if they do the testing at the point of probably even at the point of departure.
Uh-huh.
They can probably ask them to get the test done before we board you in the flight, and at the point of entry in the country, wherever. For example, the way it is in India, any flight coming from anywhere in the world, they want a COVID report at the point of entry.
But this is actually
Within
very bad. I feel, Dr. Cover, everything will be affected. Everybody, people who have small businesses, and people will again stop going out of their house. They all are very scared. Like, this news is not good, actually.
uh, let's see how it spreads. or let us see how it is prevented from spreading. And but the point is, how much can you close the borders? How much can you delay the opening of the flights? And how much can you delay? You cannot be under lockdown forever.
But
In
everybody
India, if
feels
you
scared risking their life going outside, Dr. Cover.
yeah, I agree with your point. But you remember the lockdown in India
Yes.
when it was something like 2 months
Mm-hmm.
lockdown?
Yeah.
It was a proper lockdown. And
Yes.
in that lockdown, the disease was like, I mean, it was, the numbers were so low.
Yeah.
But the moment they opened the lockdown, they released the lockdown, within a few weeks, the numbers started shooting up.
Yes.
So how long can you keep those things? So it's not a permanent solution. But yeah, people are taking precautions in UK. They are taking precautions. I have seen they
Mm.
are very careful.
Yeah.
You won't see people without mask unless in closed areas. Certainly in open areas, in gardens, if they're walking around, they may not be wearing the mask. I haven't seen them wearing. Most of them are without mask when they are in an open garden. We just were in the garden before this interview, and by the side of a lake, most of the people were not using the mask.
Mm-hmm.
But in general, in closed areas, I have not seen a single person not using the mask. In
Oh.
the last 2 weeks, more than 2 weeks, I have not seen a single person in 20 days not using the mask in closed areas, in the malls, or in, eh, even outside the malls, on the pavements when they're walking around. I've not seen them without mask. They are very careful here. But
That's a good.
at the same time, uh, I mean, the carelessness level is pretty high in India. I've seen people without masks, just, you know, not being careful at all.
So,
In
Dr.
open.
Kaur, what do you suggest at this point? Like, of course, we are into the situation, we all are facing this. So, what precautions is something more to be added, or the same precautions will work out for everyone?
I think the same precautions would work. Same precautions would work, but probably the scientists would have to tell us whether we are going to be more strict with our hand washing, with our mask, whether a special mask would, or a three-layer mask which we are
Okay.
using, that should be mandatory, because the masks these days that people are using,
Mm-hmm.
more than half of them are using just a cloth mask,
Yeah.
which is not scientifically validated. So, and whether that is good enough to protect you, or a surgical mask that we use in the hospitals,
Okay.
or N95 mask, which is proven to prevent 95% of the viruses, bacteria, and the particulate matter which gets filtered. There is also one N99 mask which I use
Okay.
frequently. So they, I mean, whether the scientists will come up with this solution, that the usual cloth masks which are being sold in the markets has become a fashion style statement,
Yeah.
something matching with your shirt or with your jacket, with your
Yeah.
coat, same print. But that is a simple thing, silk
Yeah.
sort of mask.
Yeah.
Now, whether those things are going to be probably accepted or modified or what, that is one thing that I can think of. The other thing I can think of is, of course, besides hand washing, whether they have to give some more instructions about the sanitization, like you have to spend a little more time with the sanitizer than what we quickly just take a few
Yes.
drops and do.
Yeah.
Third thing could be whether this 2 meter distance is actually good enough. This has been a question in our mind, that in a closed area, if you're staying for more than 10-15 minutes, Even if somebody is sitting in another corner of the room, and he's infective, and especially if he's coughing or sneezing, then that 2 meter distance doesn't hold good at all.
Yeah.
Even with the older, the original virus, this was our thinking. But now with this new virus, with the transmissibility rate being 70% higher, how would it be higher transmissibility? Means it can travel and probably go far, and a smaller dose of this new mutant can probably infect you, probably cause the disease, as compared to the original virus. So something is there. Either the distance carried and traveled by this virus is faster, or even a smaller dose can cause the same disease which the original virus probably did not cause. So this is the only two ways that
Yeah, absolutely.
it can be more transmissible. So that is what you can think of. But the precautions, the three main precautions remain the same. I don't think there would be any addition to them, but there could be modification in all three of them.
So
Let's
thank you,
understand.
Dr.
Let
Kavan.
us
This
see
was
this
really a great
like
information, I'll say,
like like the Japanese, they showed a beautiful laser, created. It was an experiment where uh, they made not the original patient, but they created a scene where they showed how the cuff would travel like that, the droplets would go like that, would settle down, and for how much distance the droplets would go, even if somebody coughs very hard.
Mm-hmm.
So based on that Japanese research, this 2 meter distance thing came up, because most of the droplets, they fell within 2 meters.
Okay.
Most of them fell actually within 1 meter, but a few traveled even further. So a 2 meter or 6 feet, a 2 meter distance was, it was not an arbitrary thing. It was based on certain experiments. So maybe now they will do the same experiments with this new virus, with the character of this virus, and see whether it travels longer distance, or the distance is not the issue. The
Yeah.
issue is something else,
Yeah.
that it probably, just a small dose can infect,
Yeah.
which the original virus didn't do. So a very small dose can infect a person. So they will have to do these experiments to be able to guide the public as to what would be the best precautions, and how to go about it.
ओके डॉक्टर कंवर, थैंक यू सो मच, इट वाज ग्रेट टॉकिंग टू यू एंड आपने जो आज हमें बताया कोरोना के बारे में, हाउ टू सेव आवर लाइफ, वील डेफिनेटली फॉलो दैट प्रिकॉशंस एंड थैंक यू सो मच फॉर गिविंग अस डायरेक्शंस on how to save our lives. I should say you are our lifesaver.
Oh, no, not at all. Whatever research comes through, we just go through that, keep reading, and because we have to apply in our clinical practice. So it's always good sharing those things on your platform, so that more and more people can take benefit of what it is. I'm sure people are reading about those things, but reading as a layman, they may not understand the entire thing. But when we explain, then probably it becomes easier for them to grasp the thing, and also take advantage of how our thought process works about how the virus is behaving now, how it might behave in future. So what all those things could be as possible. But let's look at 2021 in a more optimistic view, and let's hope we are not going to see more mutations. And let me tell you something. I forgot to mention that most of the mutations that happen in any virus, it's not just COVID-19. They die.
Mm-hmm.
Most of them, they die. They cannot survive, or they just wither away. But some of them can carry on the legacy of their uh, original
Yeah.
virus, and some of them can become dangerous, more
Mhm.
dangerous. So that is what we have to keep an eye on all the time.
All right, Dr. Kanwar. Thank you so much, Dr. Kanwar, and
Let's
hope to
hope.
see you in
Let's hope
2021
that.
in USA in person here. And all of our
Let's
viewers want to meet you in person, actually.
let's hope that the new year brings in a, a better 2021. 2020 has been a
Yes.
failed year, a year which nobody would want to remember.
Yes.
In fact, we feel we have lost 1 year of our life.
Of course.
In fact,
Absolutely.
we feel that way. Even though we learned a lot of new things,
Yes.
we learned to live in a different way.
Yeah.
We learned to behave with other people in different way, and we haven't hugged anybody except our family member. We haven't shaken hands with anybody in the last 9 months except our own family members. So we have learned so many things, learned to live in a different way. But let's hope 2021 is it brings gradually brings us back to our normal life. Maybe it may take 6 months, but gradually, if we can even say that the middle of 2021 we'll be able to shake hands with somebody, that would be still a very optimistic view. It
Of
would be
course.
still
Next year we
very
should
optimistic
celebrate in
view.
person our Christmas and New Year Eve with all of our near and dear ones. So Merry Christmas to all our viewers. Merry Christmas and Happy New Year. Thank
Thank
you,
you and
Dr.
Merry
Kanwar.
Christmas to you all.
Thank you
Merry
so much for
Christmas
your
to you,
time.
Rashmi and Janak, and to everybody who's watching.
Thank you.
Thank you.